Thank you very much. Appreciate that, Mr. Chairman. Uh, Thank you again for holding this hearing on this very critical issue. The healthcare supply chain is incredibly complex, and we need to do more to protect our supply chains from vulnerabilities. This is not only a health issue, but a national security issue. Public health and wellness should not depend on foreign adversaries, plain and simple. I'm proud to be a founding member of the American-Made Medicines Caucus with my good friend, Chairman Buddy Carter, and look forward to advancing key policies on this particular issue. I'm also encouraged to hear that we're already making progress to invest in domestic manufacturing. Last year, I had the privilege to visit MedNap, a company in my district that specializes in saline and medical grade wipes. This company has recently expanded and has significant plans to expand further, but struggles to compete with China, unfortunately. We must protect American leadership and innovation with regulatory and market certainty. I look forward to learning from you today, the witnesses, and already have. But the first question is for Dr. Pivenzenzi. Your organization has unique visibility into the domestic pharmaceutical supply chain. Your testimony mentions, and I quote, a fundamental shift in the market is needed to align supply and demand forces. Can you provide more detail on the types of incentives needed to make this shift, please?
Thank you, Congressman. I appreciate that opportunity. USP is working in a public-private partnership to address the two sides of this, the incentives that you describe on the one hand, and then the capacity on the other. On the incentives side, the incentives really come back to the buyers. The buyers need to be incentivized to make the investments in resilience, which means to purchase medicines where they can rely on the quality, where they can have a higher expectation of consistency, and not only purchase on price. However, those buyers today don't have the data that they need to make that choice, and simply paying more for the same medicine achieves nothing except wasting patients' money. And therefore, what we also need, the second part of this, are a set of benchmarks that can describe what does consistent quality look like. How do we consider things upstream? For example, a manufacturer who buys their API from trusted sources in Europe or from two locations rather than from an adversary. These become factors, and a variety of those factors can result in something that will be rewarded through a better contract. So these are the two pieces that we're putting forward when we talk about our supply chain resilience initiative, benchmarking initiative, sorry.
Thank you. Again, sir, would it be helpful for the federal government to conduct a national security assessment on the location and volume of APIs and key starting materials in countries of concern that are used to make drugs for the U.S. market?
Absolutely, yes. Unfortunately, we're in a position to be able to do that now that we wouldn't have been able to 5 years ago. USP has already completed mapping nearly all locations for APIs for 94% of U.S. medicine. We are in the process and only need a few more months to complete the KSM analysis, which is essentially where are the current key starting materials coming from for those APIs. The typical medicine today, if you randomly pick something off a shelf in a pharmacy, would probably be a solid oral dosage, a pill, made in India with an API or at least a key starting material coming from China. And so this mapping has to go upstream to that last step. And then we're not done. Then we've assessed risks. And the next step, we begin the process of fixing the problem, which partly could be figuring out different ways to make those APIs. And so perhaps the only key starting material in the world for a certain antibiotic is from China. Well, let's make it a different way. Chemistry will allow different pathways, and new technologies for manufacturing allow us to use those new pathways. And then the final thing is that the benefit of chemistry is it doesn't change. So we only have to do that work once, and then we have a permanent database that we can use for the entire medicine supply to find alternative routes. And this is within our reach in a couple of years for fractions of a billion, less than 100 million. It's right here, and it's available today.
Very good. Thank you. I yield back, Mr. Chairman.